Tired of the conflicting advice in the world of health and wellness? Ready for clear, science-backed strategies to live a longer, healthier life? Welcome to the Duration Wellness Show. We focus on health and wellness education to help you become a better, more informed you. Wherever you are on your journey, we're here with you for the duration. All right. Well, welcome to the Duration Wellness Podcast. So we're really excited for this podcast. And of course, this podcast is just for educational purposes only. So not intended as actual medical advice, but very excited for today's podcast. So I am today's host, Dr. Wells, currently Dr. McCarthy, but to be Dr. Wells. And with me is Dr. McCarthy, who is actually my mom and has been practicing medicine for decades and has a wealth of knowledge. And so we are very excited today to start one episode on dementia in a series that we're going to be doing. But welcome. So excited to have you. If you would just want to give a little introduction for yourself.
Well, thank you. It's a joy to be part of this podcast. And just on my experience, so I've been a practicing internal medicine physician for over 40 years now. And I had a practice that I retired from a few years ago, but I still practice internal medicine at a homeless shelter downtown, which my husband and I established 32 years ago. So I go there every week and act as the medical director and see patients, and a lot of addiction medicine, psychiatric issues, but a lot of internal medicine issues also. And trying to use more holistic approach even for those patients that come in off the streets. But that's a whole nother podcast. And so, but yes, and then the last probably 15 years of my practice, I started doing more research on my own on integrative medicine and nutrients and things that would help rather than just giving a pharmaceutical, which has its problems and side effects. And the more and more I studied that, the more interested I became in it. And so that's really the reason why I have all these notes, 87 pages of notes on dementia, because I've just been reading and accumulating and trying to learn as much as I can about that.
Yeah. And just to brag on her, she has been ahead of the game, especially in integrative medicine and looking at a person as a whole. And when I asked her about this dementia podcast, and doing an episode, she did actually send me over 87 pages of all these handouts and write-ups that she had done in terms of research for her patients. And it really is very exciting. And then we were like, well, this entails so much because, again, it makes sense. The body is complex, right? And so it's better to look at the whole picture and the whole person. And so to even talk about something like dementia, it does take a few episodes to even skim the surface of what there is. So very, very excited about it. So I think just to jump into it, I guess let's start with what is dementia, right? People talk about dementia. They talk about Alzheimer's disease, cognitive decline. What do those terms actually mean?
So really, dementia is an umbrella term for acquired decline in cognitive function that is severe enough to interfere with daily life. So, and they break them up, the different types of dementia, according to the different pathology in the brain from the dementia and the typical clinical features. But the 60 to 80% of dementias are Alzheimer's dementia, and that we're seeing an increase in, especially as we have the baby boomers getting into that age. And also we've had more cognitive insults and toxins in the environment that are also triggering an increase in this cognitive decline. But the pathology there for Alzheimer's are deposition of amyloid and tau proteins and this amyloid plaquing, which causes neuron or nerve cell death. And you see more of an insidious onset where patients will start having some memory impairment more than the normal for aging, and later we see the language and visual, spatial, and executive dysfunction. So that's pretty much what most of us have seen with loved ones, but also a pretty common dementia is what we call vascular dementia, which is caused by cardiovascular disease and poor health of the endothelial lining of our blood vessels in our body and our blood vessels to the brain. So vascular dementia is also fairly common. We can see it also from strokes and transient ischemic attacks and compromising circulation and oxygenation to brain tissue from the blood vessels. That tends to be more focal neurologic signs, fluctuating decline, and of course you see it associated often with coronary artery disease and other cardiovascular diseases. And then we have other types of dementia that aren't as common, like a Lewy body dementia. That's a different type of protein that is deposited in the brain and causes cell death. And that's an alpha-synuclein or Lewy bodies that are deposited in the cortical areas of the brain. And there we see more fluctuating cognition also, but a classic finding or symptom is they will experience visual hallucinations often. And so they have Parkinsonian-like movements where you have slow movement or bradykinesia and that Parkinsonian gait. So a little overlap there. And of course, Parkinson's itself can cause a dementia, and we know that exists. And then there are other ones like frontal temporal dementia that occurs at very young ages. And there we see a lot of behavioral changes and personality changes. You can have mixed dementias and Huntington's disease dementia. That's a genetic, type of dementia. And other ones that are caused from the viral insults or prion disease, like the mad cow's disease. But those are not as common. And the same for normal pressure hydrocephalus, that can cause the dementia, and that's where you have increased pressure on the brain and the ventricles dilate, and then you can get urinary incontinence and cognitive impairment with gait disturbances. But just for this podcast and the bulk of our talk today, it will be on Alzheimer's.
Yeah, the more common dementia. So, like she said, there's just so many different types in that category, and which is why there's a whole specialty, neurology. That's literally what they do. It's just a specialty for all these brain diseases. So there's so many subtypes. But what most people think of when they're talking about dementia, and when we're talking about, dementia prevention and risk factors and everything, it's going to be the more general Alzheimer's. So just because, again, there's so much.
Yeah.
So I think, something that people ask a lot about is the dementia, is it mostly genetic, or is it lifestyle or environmental, or is it all a mix of those? What do you think about that?
Well, that's a loaded question. It's a mix of it, really. So we know that it depends, too, on what type of dementia you're speaking about. Of course, something like Huntington's disease, that dementia is from a genetic insult. But so there are both genetic factors and lifestyle and environmental factors that play a role, to be honest. And so with Alzheimer's disease, there are several genes and genetic changes that increase your probability of developing Alzheimer's. And one of them is the apolipoprotein E gene. The apolipoprotein E gene, comes in different forms: E2, E3, E4. E3 is the most common. E2 is protective against cognitive decline, but E4, apolipoprotein E4, puts you at a greater risk of developing Alzheimer's. So there is one that we're going to go into in more detail in a future podcast. Yeah. But that is one genetic one. And another brief one that I can mention is the mutations on the MTHFR gene, which interferes with your folate and B vitamins and the methylation methylation of these B vitamins that they impairs their use as, I would say, brain nutrients, because they cannot they're not being produced enough, and they're also causing you to have an elevated homocysteine level, which also aggravates vascular dementia. So it's kind of can be a double whammy there, and something that can easily be modified, that genetic risk. So those are some of the genetic risks. Of course, frontotemporal is genetic, but again, with Alzheimer's, as we're going to go into, there's hope, because they're even though you may have these genetic risks, they can be modified and changed with good discipline. So we can see some encouragement there, and with the newer research coming down the pike, there's hope.
yeah, which I think is exciting. I think almost all of us probably know somebody who is affected by dementia, right? And especially within family members. And it's, your dad, my grandfather, right? That's what he died of, basically, was dementia. And we saw that decline. And so knowing that we have a higher genetic risk, right, it is really encouraging to see all these modifiable factors that actually can have a role in, decreasing our dementia risk.
Yes.
So I think let's get into maybe some like food and diet interventions that can be done. So I think there's like a lot of headlines in terms of different foods that can lower dementia risk. I know one study even mentioned high-fat cheese could maybe lower dementia risk, but then people talk about also a Mediterranean diet. So what do you think about that in terms of diet?
Well, first off, we have to look at now food as medicine. For a long time, we just looked at pharmaceuticals as medicine, which can cause more problems than helping you in some cases. But food as medicine. So you want to be taking in good food. So that is the farm to plate, fresh food, God's food, not loaded with pesticides and sprays and toxins. And I'm sure most of the audience has already heard about the dangers of eating ultra-processed foods. So what are ultra-processed foods? Those are foods that are processed to the hill, and they have added many chemicals to them to preserve their shelf life. So if you have food that can sit in your pantry for several years, then it's probably not a good thing to take, And you have all kinds of emulsifiers, forever chemicals, just really a lot of processed seed oils that we are finding out now are so harmful to the body and brain health. So even more so than sugar in some studies, the seed oils that are processed, your safflower, sunflower, soy, corn, all of those oils are really unhealthy. The healthy ones, of course, are your olive oil and avocado, maybe. Coconut oil is great because you got your medium chain triglycerides that may help. So really staying away from processed food, eating God's food, and also you can have that Bobby approved app or Yucca app in your phone. So when you go grocery shopping, you can hit the QR code to the food and see if it is healthy, if it is good for you, and if it's not, it will tell you why. So I think that's a good one. But basically, the two diets that have been studied and shown to be a benefit for brain health are the Mediterranean diet and the MIND diet. So Mediterranean diet is good too for our cardiovascular health, and that basically they recommend that you have whole grains, that's your oats, quinoa, brown rice, whole wheat bread, at least 3 servings per day. And a lot of people skip that for their keto diet, but whole grains are very important for your brain health.
Yeah, especially I think the focus on healthy whole grains, right?
Yes.
I think a lot of times people now think of grains and they think of like white bread and like pasta and things like that, but those healthy, where they really have high fiber content for grains, I think is we find healthy.
Yeah, very good. Yeah, high fiber is key there. And also those are foods that feed the good bacteria in your microbiome, those high fiber whole grains. So, which helps with your brain health if you have good, healthy gut flora. Yeah. But also the Mediterranean diet recommends 2 servings per day vegetables, and they do include leafy green vegetables in there. I would say the difference between the Mediterranean diet and the Mind diet is that the Mind diet tends to push more of the kale and spinach and green vegetables than the Mediterranean diet. And also berries, at least 2 servings per week. Now the Mind diet pushes berries and strawberries and to have frozen more than kind of outdated fruit that's not in season. So organic frozen fruits and vegetables are actually healthier for you when it's out of season, those foods. But again, the only difference between the Mediterranean Mind diet is they really push blueberries, like you said.
Which I think a lot of people probably haven't heard of the Mind diet. I think it's not as common and talked about as the Mediterranean diet, but it is really, it's interesting. It's a little bit, I would say a little bit more rigid than the Mediterranean diet, but I do love that they have such a focus on like the blueberries and berries and those which plants we know those have very high antioxidants, really good for brain health, and so it does make sense that they would be on that more specific for the brain diet. So, and we'll link both of those studies so that, or not studies, both of those diets below. But I mean, everybody can also Google it and see. But but it is. I do love the benefits that have been found with the brain for both of those. Yes.
So we got whole grains, vegetables, berries, nuts. They said to increase that to 5 times per week. And then beans and legumes, 3 to 4 times per week, and that's a good source of protein too. Of course, fish, at least 1 meal per week, and we prefer fatty fish and fish that is low in mercury. That would be your smash fish, salmon, mackerel, anchovy, sardines, and herring. But you can also Google fish and check for its mercury content. We really are trying to get away from the heavy metal, especially mercury, because it's unique, and the damage that it can cause in the brain tissue and inflammation of brain tissue actually mimics Alzheimer's disease. So it's real important if you have amalgam fillings or eating a lot of fish that's high in mercury that you get that level checked, and if it's high, detox it, get rid of it with a chelating agent.
And I think that's something people don't always think of, right? Is because we are always told how healthy fish is, how good it is for you, and that's very true, but you also have to think about where you're getting the fish from and what type, right? So is it a farm fish versus a wild fish, right? Because farmed fish, they can be giving it all sorts of antibiotics, and the type of food that it's having, it really changes the nutrition content in the food. And then also the mercury content, like you said, mercury is very bad for the brain. It's one of those very toxic chemicals to the brain. And so looking at the mercury content in fish is very important. I mean, they have a whole warning for pregnant people because of how serious that can be. So definitely something to think about for fish.
And that's from the old time, centuries ago, where they had hat makers. That Mad Hatter disease was from high mercury content, which was an occupational toxin for them. So
crazy.
Literally crazy. They were crazy. But and then they recommend poultry at least 2 meals per week, skinless preferred. Olive oil, of course, for your main cooking, or coconut oil I like too. Some protocols would allow for 1 small glass of wine, but as you will share for us, that I know as much as you ladies and guys would like your 1 glass of red wine, and it's beneficial for pycnogenols and so forth. The studies are showing now that any alcohol consumption can hinder cognitive function and even increase your risk of cancer. So sorry to be a Debbie Downer, but
no, it's true. I mean, I always tell Dr. McCarthy, I love my glass of red wine every once in a while, but unfortunately, my argument that maybe it's good for me is no longer valid. It is a neurotoxin, and we're learning more and more about how, unfortunately, it is not good for your brain. It does increase dementia risk, and we'll get into it a little bit, but it's really there's no benefit to it. Other than that, I enjoy it, but that is about it. So it is kind of sad that it's not good for the brain, and it is a neurotoxin. So.
And it is a sugar, an empty carb, and sugar we know really can trigger cognitive decline. So and cancer. So But basically, that's it. Those two diets, and like we already went over the other difference with the Mind diet, they are more rigid, like you said, and Mediterranean diet will allow cheese, which has been shown to be protective now and helpful, and they will allow yogurt and potatoes. But the Mind diet does not promote dairy and potatoes and cheese, but cheese just in limitation. But again, this study came out with high fat cheese and fermented cheeses were very helpful for the brain. So I would steer more, my own opinion, with the Mediterranean diet.
Yeah.
That's, yeah.
And sometimes you do wonder about those studies, right? There's a difference in terms of dairy products too, right? So it's what type of dairy products are you having? Are they full fat where there's not a lot of antibiotics and not as much processing versus, the other
American
cheeses that
cheese.
that's, a cheese product right now. A lot of times people, it's not even real cheese, right? That they're saying that they're having, right? So you do wonder also in those sort of studies what's there. So
well, in that one study that just came out from the Malmo Diet and Cancer Center in Sweden, they took over 27,000 individuals, and those that had a high fat cheese consumption, that was associated with 13% lower risk for all-cause dementia. That was significant, and a 29% lower risk for vascular dementia over 25 years. So there are some studies showing differently that than what we used to think, that the cheeses are actually beneficial. So,
yeah, which is interesting.
Yeah.
I also think, the Mediterranean diet, and this Mind diet, they're very anti-inflammatory diets, right?
Yes,
and so I do think that also is part of it, right? Overall decreasing your inflammation and, and I also think it's very high in nutrients. And so I think it'd be important for us to talk about, what supplements, nutrients, do you find help? I think one of my favorites, so I'm going to start with it, is chocolate. What do you think about chocolate?
Yes, I love chocolate too, but it needs to be dark chocolate, and that is because dark chocolate is made from the cocoa that contains theobromine. So theobromine is associated with this slower epigenetic brain aging. So it basically slows down telomere shortening. So what is all that? Each year that we get older, we have an increased percentage of telomere shortening. Telomeres are the little caps at the end of our chromosomes, and so as the telomeres shorten, we also have cognitive decline. So taking this chocolate really helps with stabilizing the caps or telomeres and having less shortening with aging of the telomeres, and that improves our overall longevity too, for our body and our brain health. So, but you do, like everything, like fish, you have to watch for mercury. Well, for dark chocolate, you have to watch for heavy metals like cadmium contamination. So always just have to check your supply, where it's coming from. And,
I mean, I think that is definitely true, right? Like Hershey's dark chocolate bar is not going to actually really be beneficial to your brain. That's actually a lot of sugar and not very good for you. But like the really healthy cacao and the high percentage, low sugar quality, that's where it really is very beneficial, which is awesome because I love it. So,
so it is the cacao percentage and where the source is from. That is important.
So what do you think about nicotinamide? I hear about that a lot.
Yeah, nicotinamide is vitamin B3, and that helps with the aging brain cells also. So and helps fight dementia. It works by boosting the energy in our neurons, and those are our nerve cells in the brain, and actually helps to clean out harmful proteins that accumulate in the brain tissue. So it does, and it's also a good antioxidant, as is green tea, is another good one that does similar things that nicotinamide does. But I like nicotinamide because it's also good for skin cancer protection, decreasing basal cell and squamous cell cancers by 40%. That's significant. Reoccurrence of those skin cancers. So, nicotinamide I would have on my list.
Nice. Okay. And what do you think about omega-3s? I feel like people hear about those all the time.
Okay, omega-3s, that's our EPA and DHA, right? And they have great anti-inflammatory effects for the whole body, including the brain, and that helps to protect the neurons from damage also. And it's also in the DHA, especially, is in the membranes of our neurons. And so higher levels of omega-3s have even been shown to increase the hippocampal volume of our brain. So the hippocampus is a very important part of our brain for abstract reasoning and emotional center of our brain too. So, but that has been that volume of that area of the brain increases with omega-3s. So I like omega-3s. Of course, our diet now, we have more omega-6s in our diet, which are pro-inflammatory, as opposed to the omega-3s, which are anti-inflammatory. Again, we want to avoid corn oil, processed seed oils like canola oils, soy oil, sapphire oil, any of these hydrogenated fats, margarine. Remember when they would give you smart butter?
Smart butter, which is not smart. Not good smart. To make you smart.
It's all out the window. Yeah. And so just be increasing your intake of these omega-3s with the small fatty fish, or taking a good supplement like we discussed. Also, it's important to get a good omega-3 supplement that isn't loaded with mercury or other contaminants, and you can use krill oil that is very well assimilated into the brain and the body, or some good Nordic marine supplements. But it definitely is important to have omega-3s in you.
Yeah, no, I definitely agree. And in terms of supplements, I think a lot of times people will bring up, that they can go rancid, but something to remember is that you can actually put it in the fridge so that it actually is less likely to do that, which is helpful.
That's a good point, yeah.
So let's see. One of my other favorites that I'm going to bring up is NAC, because, I take it. I have my husband on it. We love it. I think it increases glutathione, which is a master detoxifier. So what do you think of that?
Oh, I love NAC. NAC stands for N-acetylcysteine, and like Anna said, it is really important for the production of this antioxidant glutathione. And what glutathione does, it's hard to get glutathione on its own as a supplement. There are some companies that make a sublingual type of glutathione with a liposomal shield, but actually, if you just take NAC or N-acetylcysteine, it helps to produce the right amount of glutathione that your body needs, and that is so important for detoxification of heavy metals and other toxins and harmful substances to your brain. So, and it's good for our liver, our lung. I use it at the Mission for even addiction and cravings of alcohol and opioid addiction. It's been shown to be a benefit. So it's a good one to take even if you're not worried about your brain health.
Yeah. Well, and I think especially just we are exposed to more toxins, in this day and age. And so just supporting that, detoxification pathway, I think is so important in decreasing inflammation to the brain. So it makes sense. Our body as a whole, right? So what do you think about mushrooms?
I also like mushrooms. I don't like how they taste really, but mushrooms, especially lion's mane, has been shown to be very protective on brain health because it stimulates a nerve growth factor in the brain that improves your brain function and protects against age-related neurodegenerative diseases. So and it's good for longevity, but I do like that it stimulates the brain neurotrophic factor for triggering more production of neurons or nerve cells in the brain. So very important. You can get it in either lion's mane itself, or sometimes you can get it. Om has a powder with all the different mushrooms in it and stir it up with some water. Doesn't taste too bad, but it is a good source also, mushrooms, especially lion's mane.
Yeah. Well, and I also think like the ergothioneine, that's an amino acid that's specifically just found in mushrooms, and there's a lot of benefit that's been found in terms of brain health. So I think that's something else too in terms of mushrooms that can contribute.
Yep.
So what do you think about lithium?
Okay, so lithium is pretty new. I've read about it a few years back, but now it just kind of came back with a study that they did with lithium orotate. It was an animal study, but I've seen other studies using this supplement. Lithium orotate, not to be confused with the pharmaceutical grade lithium that we use in bipolar patients and mood disorder patients. Lithium orotate is a natural mineral in the soil, and lithium orotate has been shown to, it's a natural product, I look at it as, has been shown to decrease that amyloid plaquing, that binding of the amyloid beta protein. So amyloid, remember, that's the harmful protein in our brain that leads to dementia. So this lithium orotate reduced actual pathological changes and memory loss. So they are looking into it now for prevention of Alzheimer's even. So I would say that's at least something to keep your eye on. And if you wanted to take it, start taking it now, it would be in that form, lithium orotate.
Okay, interesting, very interesting. What about the B vitamins? You know, we touched on B3 a little bit, but like, you know, B12, methylated, unmethylated. What's your thought?
So that is also very important. It's important for mental health. It's important for dementia protection, and they need to be methylated B vitamins, not just a folate or a folic acid, but a methylated folate, methylated B12, because that allows these B vitamins to travel through the blood-brain barrier. That's a protective barrier that protects the brain tissue, but it's also a blocker. So if you get the B vitamins into your body in a methylated form, it will go through the blood-brain barrier and then produce nutrients for brain health. So methylated B vitamins are very important too.
And then I feel like there's a lot of buzz about this lately is ashwagandha. Everybody's talking about ashwagandha. What do you think?
Ashwagandha.
Ashwagandha. There we go.
Ashwagandha is very important now. We're finding out for moods and for anxiety and depression, but also for cognitive health. So this one study showed that it reduced the buildup of harmful brain proteins and lowered oxidative stress and inflammation in the brain. So remember, when you get oxidative stress and free radicals, that's all pro-inflammatory. Any nidus of inflammation in the body is going to be a troublemaker. So ashwagandha, that I am using now at the Mission Clinic for their anxiety, rather than using a strong gun pharmaceutical that has its side effects, and it is working well for them. So
very cool.
Some naturals that do help, you know.
Yeah, nice. And then what do you think about essential oils? I feel like they had a big, you know, following for a while. They were all the rage. And then, you know, now they kind of have fallen out of favor again. And then some people still love them. Do you think that it has any application for brain health?
Absolutely. In fact, they just had a recent study using menthol. And menthol, of course, these essential oils can work through the olfactory nerve to the brain. But menthol had really protective effects on the brain. And also, I listed lavender, jasmine, sage, and cedarwood have shown in some clinical trials to improve sleep health, which will help what you go into, and with your excellent supplement, into quality brain health and with good sleep. Other oils like rosemary oil or even peppermint oil are helpful, but they're stimulating, so you shouldn't take that at night. And scent of rosemary, you can actually take that in drops, which is what I do, these oil drops of scent of rosemary oil, and that rosemary has been in many studies shown to be very beneficial for brain health. So those would be the biggies. And it also helps the ones that are calming at bedtime, like the menthol and lavender and so forth. They also calm your nervous system down, so it decreases stressor hormones like cortisol, so you get, again, better quality sleep, improves cognitive function. So essential oils still have a role there.
Yeah, it's interesting. There used to be a saying like rosemary for remembrance. And you wonder if it came from that, you know?
Probably so.
So, you know, something else I hear a lot about are eggs. You know, it used to be that people were like, eggs are not good for your cholesterol, don't eat them. And now we've learned, no, actually eggs can be good. And I think especially in brain health and for dementia prevention, you know, eggs and probably the choline that's in them are so important. But what do you think about that?
Well, the choline and in eggs is very important, and we know that eating just one egg could lower your risk, it said in this one study from the Journal of Nutrition, where the researchers, they followed over 1,000 older patients and adults and older adults and found that those who ate eggs more often had a 47% decrease risk of developing Alzheimer's.
Yeah, that's huge. That's a big
percentage.
Yeah, it is. Yeah.
And again, for a while there, we were saying eggs are no good, and just like we were saying butter's no good. Eat. I can't believe it's not butter. Yeah. Or you were eating the egg substitute, right?
Yeah.
That was out too. That was terrible. Yeah. But whole eggs, real eggs, are very nutritious for the brain, and because it does provide choline, which helps with development of your neurotransmitters, and it helps with the membrane of your neurons, your nerve cells. And in the production of acetylcholine, which is a very important nutrient for brain function.
Yeah. I mean, I think we're just hitting the tip of the iceberg with choline. I think there's just a lot of studies, even just with the development, like when you're pregnant, right? We know that choline is important for brain health, but there's more and more studies that are showing now, if you have an increased choline intake during your pregnancy, the baby has a higher IQ. And even just going from 450 milligrams to 900 milligrams of choline has a huge jump in the IQ of your baby, which is huge. And then they had another study that I thought was so interesting of that moms who had a higher choline intake, their babies had a lower risk of depression. They had a lower risk of schizophrenia when they were adults. So it's just, there's something that it really has such profound effects in the brain that I think we're just starting to learn about. And in terms of the eggs, I think something else that's important is it is in the egg yolk, because a lot of people will just have egg whites because they want to have lower calories, but it's actually in the egg yolk. And
the choline.
It's important to have that egg yolk when you're having your eggs. A lot of good
nutrients are in the egg yolk.
They are, yeah. So
selenium and so forth.
Yeah.
But real quickly, there are some good supplements like alpha glycerol phosphatidylcholine. That's an alpha APC that has the benefits of this choline supplementation, but in a good format that will be assimilated and bioavailable to the brain tissue. So that's the one I take, an alpha GPC. And but again, it's important for the myelination. The myelination is your covering for your neurons. It's like a protective sheath, and choline and omega-3s are important for that myelin sheath, that protective covering.
Yeah, which basically your nerves don't work without that myelin sheath, right? So I think when I was in medical school, and I love this analogy, somebody said your nerves, if you're looking at a wire, right? Those are the actual wires that are there, but then that myelin sheath is that covering, that protection, right? And so without that, it's not going to be able to give the signals that it needs to. And without the signals being transmitted, right, it's not going to work. So that's why that sheath is so important. So,
and that's on the long wire called the axon of the nerve cell. And then we have our synapses too. But choline is good for all of it. You know, it's very beneficial.
I think we're really just, in terms of brain health and how it affects the brain and how beneficial it is, I really think we're just at the tip of the iceberg with research. So something else that I think I personally love, and I'm so happy now, is like finally showing so much benefit and people are starting to learn about it and take about it, but is creatine. Creatine is one of my favorites. But what do you think about creatine?
Okay, so I was bad on this because for the longest time I was listening to and reading medical literature that creatine can hurt your kidneys and be bad for you and all that. But now that's been all debunked, and we know that creatine is actually creatine monophosphate, 5 grams a day, is really good for your muscle metabolism and your health, and taking it up to 10 grams a day is very beneficial for neurocognitive function. So I would also suggest taking that, probably if you can tolerate 10 grams a day. I still only take 5, but just because it's hard for me to mix it up. I try to mix it up in my salad or yogurts or cottage cheese or something. And some people, it doesn't bother them at all. But yeah, up to 10 grams is really helpful for your brain health, creatine. So no longer has that bad rap. And how that works is by increasing your ATP production. That's your energy in your brain cells. That's how we have our energy produced for our brain cells from ATP production. And choline increases the formation of the ATP quickly, especially during strenuous mental tasks.
Yeah.
So it's like a quick reserve to take maybe before an exam even.
Yeah.
But,
well, I mean, I love the data that has come out too in terms of like sleep deprivation, which,
Yes.
you know, in med school, as much as we would like to actually say that we're the healthiest, we are not, because you're
Terrible.
forced to be sleep deprived. You know, you're in these super high stress environments. But I love the data that's there now for if you are sleep deprived, how it can actually help with your brain
Yes.
function.
Yeah.
And then even the data that's coming out, you know, with all these football players and all these traumatic brain injuries, and how it can actually help, you know, protect the brain with those too.
Yes,
So
yes.
so many applications, I think, that are showing how important it is for brain health and for
Yes.
just overall improvement in your brain health. So
yeah, it is a good one for sure now to add. And even stroke patients and like you said, trauma patients, brain trauma patients, it's very helpful.
Yeah.
I will say another aside here is that increasing your energy production in your brain cells by increasing the APT production with creatine can actually be downregulated by, guess what? Corn fructose syrup. Or fructose corn syrup. Either way, that fructose corn syrup in processed food should be avoided because it can actually downregulate the benefits of creatine and decrease ATP or energy production in your brain cells. And that you don't want to have happen because our brains work really hard, you know, and so, you know, I know, like I shared with you before, we don't see our brains working out like our muscles in the gym, but our brain is really needing a high amount of energy and ATP production to function properly. So
yeah. Well, and it's interesting because, like, we know that fructose, you know, and all that, you obviously need sugar that's a healthy sugar, right, for your brain to work and process and everything. But all these really inflammatory sugars, right, a very high sugar load, we know just increase inflammation in your body, and that inflammation is not good for your brain, right? So there's a hit on the brain right there, and then another hit, you know, when it's decreasing the energy. So it's very interesting there.
It's important.
Yeah. So in terms of another anti-inflammatory, I feel like a lot of people talk about, what do you think about turmeric for the brain?
Yes, I know a lot of people know about turmeric or curcumin, and we know it to be a great anti-inflammatory, not just for the body and musculoskeletal system and joints and so forth, but also for our brain. Yeah. So it really has been helpful in protecting that protein clumping in Alzheimer's and in Parkinson's disease too. You want to try to get a turmeric that has good assimilation, and that would be one with black pepper, purpurine in it, or one that has a liposomal shield around the turmeric, which is basically a fatty coating, if you will, so it is better absorbed into the brain and the body. So, and to eat it also with high-fat meals helps increase the absorption of turmeric or curcumin. So those are just some little tips there on how to take it. But yeah, definitely that's one too. I know the supplement count is going up here, and you're all saying, I can't take that too. But these are ones I'm mentioning that really have been shown to be beneficial and target brain health. And for me, that's a big concern. I know it is for a lot of patients my age or older. So
well, and also turmeric, you know, you can cook with a lot of turmeric, right?
Yeah.
Which is why I think it'd be interesting to see a population study of what the incidence of dementia is in India, you know, where there's a lot higher turmeric use in a lot of these anti-inflammatory foods, you know. It'd be interesting to see. So let's see, another supplement that I think a lot of people talk about is berberine. What do you think about berberine for dementia?
Is excellent. Berberine, it not only works by improving your insulin resistance and glucose metabolism and prediabetes, diabetes, metabolic syndrome, weight loss, but berberine is unique in that it is a plant supplement with protective properties because it does travel right through the blood-brain barrier and goes directly into the neural tissue, improving cognitive function. It helps, it's been shown to have a significant effect on our brain health as like what we call a master switch for the brain cells by activating AMPK, which stands for activated protein kinase. So, and when it does this and turns that switch on, and that's activated, the AMPK, it helps your brain cells to use energy more efficiently. So again, like creatine with the ATP production, this berberine also helps your brain cells to use energy more efficiently, which of course, again, is very important because our brain cells use high amounts of energy. Yeah. So you want to have a well-oiled machine there with energy production. And it keeps our brain cells well-fed, helps them to work better, live longer, boosts the levels of important neurotransmitters for our cognitive function and mood. And of course, helps with the brain cells mitochondria. So what are the mitochondria? The mitochondria are the tiny little factories in our cells that are the energy producing factories, and we are finding out that when the mitochondria are dysfunctional, that it can mess up so many systems in our body, but especially in the brain, and that berberine helps to correct that also. And improve the mitochondrial dysfunction in brain cells. And it has an epigenetic effect also, and that means that it influences the genes in your brain cells that turn on and off. So it allows your brain cells to better adapt and respond to stress more effectively. So many pathways of how berberine helps, but yeah, I would include that for your supplement pile also. yeah
has some good benefits. What about melatonin?
So melatonin, is a sleep hormone, and it does support our immune health and our brain health, and it also is very important for securing the integrity of our blood-brain barrier. So just like we want to have the integrity of the gut lining, so we don't develop something called leaky gut that can leak toxins to the brain and cause harm. Well, so we have this protective coating, as I mentioned earlier, this blood-brain barrier. So this melatonin helps to keep that blood-brain barrier healthy, because it can too, with aging and toxins and everything else, develop leakiness. And when you get a leaky blood-brain barrier, then all these toxins are able to enter the brain tissue and wreak havoc on your brain function. So that is very protective, melatonin, for defense against these keeping those harmful substances out of your brain. And it reduces the production of amyloid beta, that harmful protein that can cause inflammation in the brain. And also it's been shown to inhibit the formation of these neurofibrillary tangles that we see in Alzheimer's, and helps to clear the crud out of the brain. And so that brings me to one other thing that we've been finding out more, is that we have in our bodies, in our brains especially, this lymphatic system, which is basically your brain waste removal pathway. And when you sleep, that's huge. That kicks in this lymphatic pathway to remove toxins from your brain. And if that system, that lymphatic system, is clogged or plugged up or dysfunctional, then it can just allow these toxins to accumulate and cause great decline in cognitive function. So we're just starting to understand more about that, but I have read in some studies it might be better to lay on your left side for that drainage of the lymphatic system, or getting a pillow that kind of has your neck slightly back, but these neck nest pillows or certain designs that you can see in Google for will help with that drainage. And people that have trauma to the cervical spine, they're at risk of having that impaired too. Exercise, of course, also helps with that drainage system, but sleep, deep sleep, restorative sleep is key for having that properly function. So, but melatonin helps with that too.
Yeah. Well, and I mean, it makes sense. Like, we know that sleep is just so important in terms of dementia prevention, just overall brain health, that it's just necessary, right? It's not an option. It's the one, you don't have a choice. Like, your body needs sleep. You can't say, I'm not going to sleep for forever, right? That just is not an option. Your body will eventually shut down. Like, it has to have sleep. Yes. And that's the only time it can do this lymphatic system, right? Where it actually is working to clear out these toxins. And so it's just so important. And I think, melatonin, a lot of people, think of it as a supplement, but your body actually makes its own melatonin. And I think, and we're going to go into this on another podcast, but something else that's part of this is, that early sunlight exposure helps your body actually create the higher amounts of melatonin that's so important.
Yes.
So your body is
Isn't
making
that interesting?
it naturally, right? And then it helps. It's so cool to hear how it helps with this brain barrier, right? To actually keep that intact and keep it safe. And it has antioxidant properties as well, but trying to get your body aligned so it can make its own melatonin the way it's supposed to. And I think nowadays it's just so easy to get out of whack because we're looking at our phones, we're not outside in the natural light, all these things.
Blue light, the artificial light, blue light and so forth,
Things that will disrupt your body's natural, melatonin synthesis, the way it's supposed to, be increasing at a certain time and being made. So it's just, it's interesting. Again, the body is complex and it's all intertwined and, so it's...
But I like what you mentioned about the sunlight, because how God's designed it, if you go out in the morning sun, even for 20 minutes, and let that sunlight hit your face, it does help set your circadian rhythm for the whole day. And it really helps with that photomodulation. We're finding more about the importance of that sunlight and certain, photomodulating techniques that they're using now for brain health and also for depression and anxiety and so forth. So it's again, it makes sense though. Again, if you're out in nature and we know if you hear bird sounds and crickets and then get in amongst the forest and the trees or by the ocean and the sunlight, being out in nature itself is very healthy for your brain health.
Very powerful. So it's cool. So what do you think about multivitamin? I feel like that's very common.
That's also a new study with showing good daily multivitamins were shown to benefit cognitive function in older patients, and it was more pronounced, the benefit, in patients that had cardiovascular disease also. And you see a lot of them, these multivites have methylated B vitamins in them, so I guess that's one of the important reasons too why they work. But a one-a-day vitamin is helpful, and I try to get a decent one, So.
And then one of my other absolute favorites. What do you think of coffee and caffeine?
Oh, coffee. She and I, we're both the same. We love chocolate and coffee. So you want to get coffee, though, that's organic. And coffee is great because we know that it has these catechins in it and polyphenols, which improve brain health. But the main reason why I think it helps for brain function is it releases this brain-derived neurotrophic factor. And what is that? That basically, the neurotrophic factor actually increases and activates the brain stem cells to convert to new neurons. So it's actually creating new nerve cells in your brain, which, we didn't know that could be done years ago. But that's fascinating because there is restoration there in the brain tissue with new nerve cells. And, you of course, the way you take your caffeine, your coffee, it should, I tell patients to use it with a brown filter because the oils in coffee can trigger elevation of your bad cholesterol, LDL. So a coffee maker that has a filter, and then we're trying to go clean from microplastics. So we're trying to go with a coffee maker or the glass type of coffee maker where you have no microplastics, because microplastics, we know, I think I last read there's a credit card full of microplastics in your brain. That is also a trigger for cognitive decline, and we even know it's in the arteries of our body and have been shown to cause accelerated atherosclerosis in our arteries, which arteries to your brain too. So staying away as much as you can from plastics, no plastic water bottles, everything away from plastics as much as you can. So.
Yeah. I mean, that's the thing. There's more toxins in the environment now. So it's just trying to limit it where you can, right? So stainless steel, glass, all of that, I think is very helpful.
Yeah.
And then I think, we touched base about it a little bit before, but we'll go into it a little bit more now. Alcohol, for a while, people used to think that there was some healthy benefits, but now I think we're finding out more and more how dangerous it is. So what are your thoughts in terms of alcohol and dementia prevention?
I would say if you're really concerned about your brain health and you have risk factors, especially if you have risk factors, then I would just totally eliminate it in your diet. And there are other ways to have a good time or alcohol-free, type of drinks. But I would say there's enough to make me want to stay away from it.
I would agree. I mean, I like my glass of wine, as I said earlier, but unfortunately
it's a real sacrifice for Anna.
but I know that if I'm having that, it really is unfortunately not good for my health, right? It is, alcohol is a neurotoxin, right? So it makes sense in terms of just how alcohol affects your body and your brain in terms of it being a toxin, that it would not be good for your brain health. And so people who drink have a higher dementia risk, and it's probably partially from this neurotoxin effect. But the other part is it also affects your sleep. So your sleep quality, while you might feel like you slept well, you actually slept much worse for your sleep quality. And sleep is so important for your brain health and for dementia prevention. So it's really a double hitter. So again, it's everybody gets to make their own choice, but you do want to know about the actual risks, especially if you have a higher genetic predisposition, right? In terms of what you're trying to modify and change, alcohol is a risk for dementia.
Mm-hmm.
So,
and for me with addiction medicine at the homeless shelter, all the recreational drugs, all of them can worsen cognitive function, and what's being legalized in all these states with pot is 800 times the concentration of tetrahydrocannabinol than the pot that we used to have in the 60s. And the THC, tetrahydrocannabinol, is the chemical in pot that has caused great mental health issues and problems, especially in the young brain, but it is globally the number one cause of adult onset schizophrenia. So pot is not benign, the THC in pot, and so they have all these warnings about cigarettes and this and that, but they still kind of just make like pot like it's a light thing, but it is also very much a trigger for dementia and mental health issues. So.
Well, it'll probably, if you think about it, how long have people been drinking? And just now is really the data and the research coming out, right? So a lot of this is you can maybe start seeing the early signs of it, but it'll take some time now that it's becoming more legalized. It probably will take a while for the data and the research to catch up. I feel like that's very common, but
that's common.
But again, seeing the schizophrenia risks,
the mental health that we see now. That's it.
Right, but the dementia, it might just take a little bit for the data to catch up. So we'll see, but something for people to be aware of if they weren't. And then something else that I think is really so important, and I'm really happy now that people are realizing how helpful it is to the brain, because it's helpful for the body so much in so many other aspects of your health, but is exercise.
Yes.
So what do you think about exercise for dementia?
I love exercise, and I was saying earlier that I think exercise may be just as important, if not more important, than food that we take in. Exercise, there's so many studies now showing how exercise is so beneficial for our brain health and prevention of dementia. So there was one study showing aerobic exercise helps to reduce tau protein in the brain. And these tau proteins, they make these tangles in the brain that are like twisted strands that actually kill your brain cells. So if you can reduce that, that's huge for brain function. And also, aerobic exercise improves memory, cognitive function, and it's really, part of it is from neurogenesis, producing more of the brain neurotrophic factors that produce more nerve cells, neurons for your brain. And exercise and also promotes cell growth and expanded the memory center in the brain. Usually, we have that start to decrease as we get older, and so with our brain volume, but this exercise really helps to prevent that shrinkage, and increase, again, like I said, the nerves and nerve cell count, and then eliminating amyloid and tau protein. So it's really really helpful for brain health. And also, we just found out that there's this irisin, I think it's pronounced, it's spelled irisin. It's a hormone released by muscles during physical exercises that has also been shown to slow cognitive decline in individuals, especially at risk for Alzheimer's. So studies have shown that increasing this irisin level in the brain was associated with much improved cognitive function and reduced beta amyloid protein levels. And that is what's released during physical exercise. So that's good.
It's cool to see how it all plays a part. And I liked what you said earlier too. I think that there was a study that came out and it showed these older individuals who usually they would expect more cognitive decline, but they actually had improved memory in comparison to people in their 30s and 40s.
Yeah.
And when they looked at it, their brain was actually, in terms of like the size of neurons, much, much higher. And
yes.
so we know that is so important in terms of, decreasing your dementia risk, right? Is the more neurons you have there, then it's a sign of like the healthy brain is working, right? And
yes.
decreasing your dementia risk. So it's really cool to see that exercise is one of those ways that you can actually do that.
Yeah, I know it's harder. It's not just taking a pill or a supplement or a diet change, but I think it is an important discipline that you just have to incorporate as you get older, especially. But the thing you were mentioning, they were called cognitive super agers, and these were people greater than 70 years of age that were able to perform memory tests as well as people in their 20s. And these 70-year-old patients, the majority of them were taking their physical exercise seriously. So they were hitting the gym. But any type of exercise for 45 minutes at any frequency is protective. And I always tell my patients, start with something you enjoy. Like some ladies like Zumba. I like spin and body combat. Some may like running, even a brisk walk, starting with that. But just something so you'll be more consistent. Something that you may enjoy, and I like doing it outside, I would prefer, but you can't always do that with the gym. The other one is resistance training. So we know that the strength training helps protect us from cognitive decline, but also from falls, and just very important also for muscle strength. And just as important as muscle strength with lifting heavy weights is also the power of your muscles, because that is what allows us to quickly engage our muscles, say, should we lose our balance and start to fall. If those muscles are not only strong but powerful and able to engage quickly, that can save you quite a bit in a fall.
Yeah, so I think that's what I was going to ask is, so what do you think in terms of dementia prevention is the most important, right? Is it really intense aerobic activity, or is it the lifting weights, or a combination of some? What do you think?
I think it's a combination. I think you should do some aerobic for sure, probably 5 days a week, I would suggest, if not every day, and at least 2 days a week of resistance training. Now, we do have new studies coming in with heavy lifting of heavy weights, where you do so many reps of the heaviest weight you can lift, and even if it just be 2 reps, that may be helpful for cognitive function. I tend to go more at this age with lighter weights with more reps. But either way, any resistance training is really helpful. The other one is the HIIT training, where it's high intensity intervals where you will run or spin or do whatever aerobic as fast as you can for like 20 seconds and then rest for a minute. There are different types of setups for a HIIT exercise, but just to do that once or twice a week, that may be a benefit. But if it's really overwhelming, at least start with aerobic exercise 5 days a week and 2 days of resistance training.
Yeah.
And I think that's a very good discipline that helps significantly with brain health.
Yep. And everybody can always do something, right? So it's definitely better to do something than nothing. So.
Oh yes, and this interesting thing I just want to mention, they just had an article, research study showed that stronger calf muscles are linked to improved cognitive resilience and fall prevention. So if you have strong calf muscles, I know that can be a nuisance sometimes if you're trying to get into a boot or something, but stronger calf muscles were linked to cognitive resilience. So that's kind of interesting.
Yeah, so it just shows muscle's really important in terms of brain health, and so it's really, I think we've learned so much in terms of how important it is in dementia risk and everything, and decreasing your dementia.
Yes.
So I think this has been so good, so fun, enjoying all that we're learning in terms of decreasing dementia risk and the body as a whole, and there's so much that goes into it. We could go over a little bit about how sleep is important. And I think sleep is one of the biggest things in terms of decreasing your dementia risk.
Absolutely.
It comes up over and over again about dementia prevention, but we touched on it a little bit with this lymphatic system, but why do you think that sleep is so important for brain health?
Well, it really is the time that the body removes toxins from the brain. We know that good deep stage sleep is just important for mental health and cognitive function. It is a time of restoration, I would say, for brain cells.
Yeah.
Just to put it in simple terms. So, and again, if you're sleep deprived, and they are saying that really you should get 7 to 8 hours. Too much sleep isn't good. Too little sleep isn't good. And everybody's individual and varies, but overall 7 to 8 hours of sleep. Also, going to bed late is not such a good thing. It's better to go to bed by, say, like 10 o'clock, the latest, and get up earlier. That in some studies is shown to be more beneficial for your sleep time. I would say also that improves your sleep cycle is to not eat anything past dinner time. So 3 hours before bedtime, you should have no food in your stomach, because that has been shown to hinder brain health too.
Yeah.
And sleep.
No, I mean, I think sleep is it's foundational, which, it's foundational to so many things, right? There's so many studies that show that good sleep helps decrease your dementia risk, but not only that, it helps with longevity, it helps decrease inflammation, right? Because again, your body, that is when your body is clearing all these toxins. It's just involved in so much, which is why, we have such a focus on sleep, at Duration Wellness, just because it is, I think, the one of the largest modifiable risk factors that you can do that affects so many things for your body. Your body just really needs it.
Yeah.
But it's really exciting, all this dementia prevention and everything that's a part of it. And I think in our next episode, we'll get into a little bit more on the sleep. And I just loved getting to do this with you. It's so fun.
I enjoy it too.
Thanks for episode 1 and for everybody listening.
Yeah,
and,
thank you all for joining.
Yeah, and because again, as you see, there's so much that goes into dementia and dementia risk and brain health. So we will have a couple more episodes and look forward to it.
Well, I do too, and this was fun. So thank you.
All right, thank you. Thank you for joining us for the Duration Wellness Show. We hope you feel equipped to apply today's science-backed insights to your daily life. To find show notes, past episodes, and all the resources we mentioned, visit us at durationwellness.com. As always, this podcast is for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect those of the host. We'll see you next time, and as always, we're here with you for the duration.